Question 1. Which of the following is the primary function of the respiratory system? A. Oxygenating blood. B. Filtering toxins. C. Regulating body temperature. D. Pumping blood to tissues. Answer: A. Oxygenating blood. Question 2. A nurse is assessing a patient with acute myocardial infarction. What is the priority action? A. Administer oxygen. B. Obtain an EKG. C. Start an IV line. D. Prepare for a chest X-ray. Answer: A. Administer oxygen. Question 3. Which of the following is a common sign of hypovolemic shock? A. Hyperventilation. B. Decreased blood pressure. C. Increased heart rate. D. High fever. Answer: B. Decreased blood pressure. Question 4. In a patient with diabetes mellitus, which complication requires immediate intervention? A. Insulin resistance. B. Hypoglycemia. C. Hyperglycemia. D. Foot ulcers. Answer: B. Hypoglycemia. Question 5. A nurse is preparing to delegate the task of measuring a patient's vital signs to a nursing assistant. Which vital signs should the nurse retain responsibility for? A. Blood pressure. B. Respiratory rate. C. Temperature. D. Heart rate. Answer: A. Blood pressure. Question 6. Which part of the brain is primarily responsible for regulating breathing rate and depth? A. Cerebrum. B. Cerebellum. C. Medulla oblongata. D. Thalamus. Answer: C. Medulla oblongata. Question 7. A nurse is caring for a patient post-lung transplant. Which of the following is the most important to monitor for signs of rejection? A. Temperature. B. Heart rate. C. Oxygen saturation. D. Blood pressure. Answer: A. Temperature. Question 8. What is the primary role of the kidney in fluid balance? A. Absorbing glucose. B. Producing erythropoietin. C. Filtering blood and excreting waste. D. Secreting insulin. Answer: C. Filtering blood and excreting waste. Question 9. Which of the following is a priority action when a patient is experiencing an asthma attack? A. Administer a bronchodilator. B. Assess lung sounds. C. Encourage deep breathing. D. Monitor oxygen saturation. Answer: A. Administer a bronchodilator. Question 10. In a patient with acute renal failure, which laboratory finding is most concerning? A. Decreased hemoglobin. B. Increased serum creatinine. C. Elevated white blood cell count. D. Low platelet count. Answer: B. Increased serum creatinine. Question 11. What is the primary function of platelets in the blood? A. Transport oxygen. B. Aid in blood clotting. C. Fight infection. D. Maintain blood pressure. Answer: B. Aid in blood clotting. Question 12. When caring for a patient with a possible stroke, which assessment is the priority? A. Blood glucose level. B. Level of consciousness. C. Blood pressure. D. Oxygen saturation. Answer: B. Level of consciousness. Question 13. Which of the following is a characteristic sign of Cushing's syndrome? A. Hypotension. B. Weight loss. C. Moon face and buffalo hump. D. The increased skin elasticity. Answer: C. Moon face and buffalo hump. Question 14. When administering a medication via an intravenous IV route, what is the nurse's primary responsibility? A. Ensure the correct drug is administered. B. Monitor for allergic reactions. C. Ensure the patient is hydrated. D. Educate the patient about side effects. Answer: A. Ensure the correct drug is administered. Question 15. Which of the following vital signs should the nurse monitor closely in a post-operative patient recovering from anesthesia? A. Blood pressure. B. Heart rate. C. Respiratory rate. D. Oxygen saturation. Answer: C. Respiratory rate. Question 16. What is the most common cause of hyperkalemia in patients with kidney disease? A. Excessive potassium intake. B. Renal failure and decreased potassium excretion. C. Increased aldosterone secretion. D. Hypoaldosteronism. Answer: B. Renal failure and decreased potassium excretion. Question 17. A nurse is caring for a patient with a new tracheostomy. What is the most important action to prevent complications? A. Keep the tracheostomy tube clean and patent. B. Encourage deep breathing exercises. C. Monitor for changes in vital signs. D. Ensure the patient remains on bed rest. Answer A. Keep the tracheostomy tube clean and patent. Question 18. Which of the following is a priority intervention for a patient who has sustained a spinal cord injury at the cervical level? A. Monitor for respiratory distress. B. Assess for signs of hemorrhage. C. Initiate IV fluids for hydration. D. Monitor for signs of DVT. Answer A. Monitor for respiratory distress. Question 19. In a patient with a head injury, which of the following is the earliest sign of increased intracranial pressure? ICP. A. Altered mental status. B. Dilated pupils. C. Bradycardia. D. Hypertension. Answer A. Altered mental status. Question 20. A nurse is caring for a patient with pneumonia. What should the nurse prioritize to prevent further complications? A. Administer antibiotics. B. Encourage fluid intake. C. Monitor for signs of respiratory distress. D. Educate the patient about vaccination. Answer C. Monitor for signs of respiratory distress. Question 21. Which part of the brain controls balance and coordination? A. Cerebrum. B. Medulla oblongata. C. Cerebellum. D. Thalamus. Answer C. Cerebellum. Question 22. A nurse is caring for a patient with cirrhosis. What complications should the nurse monitor for? A. Hyperglycemia. B. Hepatic encephalopathy. C. Hypotension. D. Renal failure. Answer B. Hepatic encephalopathy. Question 23. Which of the following hormones is primarily responsible for regulating the body's circadian rhythm? A. Insulin. B. Melatonin. C. Cortisol. D. Growth hormone. Answer B. Melatonin. Question 24. In patients with heart failure, which of the following is the most effective intervention to reduce the risk of fluid overload? A. Encourage high salt intake. B. Restrict fluid intake. C. Administer diuretics as prescribed. D. Increase potassium-rich foods. Answer C. Administer diuretics as prescribed. Question 25. What is the primary role of the spleen in the immune system? A. Production of red blood cells. B. Filtering lymph. C. Production of white blood cells. D. Removal of old red blood cells. Answer D. Removal of old red blood cells. Question 26. A nurse is caring for a patient who is post-surgery for a hip replacement. What should the nurse prioritize to prevent post-operative complications? A. Encourage early ambulation. B. Monitor for signs of infection. C. Administer pain medication as prescribed. D. Assess for deep vein thrombosis. Answer A. Encourage early ambulation. Question 27. Which of the following is the first line of defense in the body's immune response? A. T lymphocytes. B. Antibodies. C. Skin and mucous membranes. D. B lymphocytes. Answer C. Skin and mucous membranes. Question 28. In a patient with a stroke, which of the following is the priority assessment? A. Blood pressure. B. Blood glucose. C. Respiratory status. D. Glasgow Coma Scale score. Answer D. Glasgow Coma Scale score. Question 29. What is the primary role of the pancreas in glucose regulation? A. Secreting insulin to lower blood glucose. B. Secreting glucagon to increase blood glucose. C. Breaking down glycogen into glucose. D. Regulating sodium balance. Answer A. Secreting insulin to lower blood glucose. Question 30. A nurse is caring for a patient with a suspected spinal cord injury. Which action should be taken first? A. Assess the patient's level of consciousness. B. Immobilize the neck and spine. C. Check the patient's blood pressure. D. Administer pain relief medications. Answer B. Immobilize the neck and spine. Question 31. In a patient with acute pancreatitis, which laboratory value is most indicative of the condition? A. Elevated blood urea nitrogen, BUN. B. Elevated amylase and lipase. C. Low albumin. D. Increased bilirubin. Answer B. Elevated amylase and lipase. Question 32. Which of the following interventions is most appropriate for a patient with a full-thickness burn? A. apply a moist sterile dressing. B, administer antibiotics intravenously. C, administer analgesics and perform wound debridement. D, encourage oral fluid intake. Answer, C, administer analgesics and perform wound debridement. Question 33. A nurse is caring for a patient who is receiving chemotherapy. What is the priority nursing diagnosis? A, risk for infection. B, acute pain. C, imbalanced nutrition. D, anxiety. Answer, A, risk for infection. Question 34. Which electrolyte imbalance is most commonly associated with diuretic therapy? A, hyperkalemia. B, hypercalcemia. C, hypokalemia. D, hypernatremia. Answer, C, hypokalemia. Question 35. A nurse is caring for a patient with hypovolemic shock. Which of the following is the priority intervention? A, administer blood products. B, monitor oxygen saturation. C, administer intravenous fluids. D, provide pain relief. Answer, C, administer intravenous fluids. Question 36. In a patient with a history of chronic obstructive pulmonary disease, COPD, which of the following interventions should be avoided? A, administering high-flow oxygen. B, monitoring oxygen saturation. C, encouraging deep breathing exercises. D, providing a low-sodium diet. Answer, A, administering high-flow oxygen. Question 37. Which of the following is a sign of dehydration in an elderly patient? A, increased urinary output. B, decreased skin turgor. C, elevated blood pressure. D, bradycardia. Answer, B, decreased skin turgor. Question 38. In a patient with a history of asthma, which of the following interventions should the nurse prioritize during an acute asthma attack? A, administer oral corticosteroids. B, administer short-acting beta agonists, SABA. C, encourage coughing and deep breathing. D, administer IV fluids. Answer, B, administer short-acting beta agonists, SABA. Question 39. What is the primary goal when treating a patient with acute respiratory distress syndrome, ARDS? A, correcting the underlying cause. B, reducing fluid retention. C, increasing lung compliance. D, improving oxygenation and ventilation. Answer, D, improving oxygenation and ventilation. Question 40. A nurse is caring for a patient with chronic kidney disease. Which of the following is the most important to monitor? A, serum potassium levels. B, serum sodium levels. C, serum calcium levels. D, hemoglobin levels. Answer, A, serum potassium levels.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.